Thank you for the opportunity to discuss with you in the next half hour on this topic, how to put an end to the COVID-19 pandemic. I'm sure all of us for the past 18 months, we've been thinking about this question all the time and when this pandemic is coming to an end. Well, in order to figure out a way to get out of this pandemic, let's look at what were responsible for pandemics in the last 100 years. And as you can see here, all four pandemics have been related to influenza viruses. Started with the first one in 1918, followed with the 1957 H2N2 pandemic, and then the H3N2 1968 pandemic, followed with the relatively mild pandemic of 2009 due to the H1N1 virus. And there were also two other outbreaks. These were related to coronavirus. The first one being the SARS in 2003, and then 2012, the Middle East Respiratory Syndrome, in which most of the cases were in the Middle East. There were also an outbreak primarily limited to parts of Africa of the Ebola virus. Now, these three did not manage to spread to an extent that can be declared as pandemic. They tried. Well, there are features of these three infections resulting not in a pandemic. And if one look at these successful influenza, and primarily they all have some sort of genetic ressortment with genes coming from the swine or avian influenza, and which manage to cross the species barrier, and they're able to infect human because human beings have never seen these viruses and have no immunity against them. But there's one feature. They succeed because they did not really kill the host in most cases, so that there are mildly sick patients that can take this virus to go from one place to another and spread to other people. And the two coronavirus that we saw with MERS and SARS-CoV-1 in 2003, they cause very severe infection. And usually the infected period is when they're symptomatic. So they're relatively easy to identify and isolate them so that we can stop the outbreak. But SARS-CoV-2 is very different. So if one look at the various measures, such as the use of isolation, such as the use of masks, of course in the 1918 pandemic flu, there was no vaccination and there was no effective drug. So these public health measures helped to put an end to a pandemic until the majority of the people were infected or immune against this virus. If you look at the current scene, we are still seeing major problem in parts of America, and also because of the recent variant, it's spreading rapidly across several European countries and also some Asian countries. So right now, more than 200 million people have been infected with this virus. And if one look at the situation in late 2020 and early 2021 is particularly bad in America. So there was this plan I call the Western approach in order to help to end the pandemic, because keeping the economy open it's important for many of these countries. And the approach taken was to try to balance keeping the economy partially open as long as the number of new cases are not too many so as to overwhelm the hospital system or the ICU. Instead, for example, in the United States, they have this Operation Warp Speed with a major funding to speed up drug and vaccine development. And with these, the hopes to stop the pandemic? Well, yes, vaccine is very important in terms of prevention and stopping infectious disease. If one look at one of the earliest vaccine used against the disease smallpox, we realize how the origin of these vaccine. In fact, the word of vaccine comes from a Latin word, vacca, meaning cow, and the virus is called the vaccinia virus. And it was this gentleman, Dr. Edward Jenner, an English physician, who observed and noticed that milkmaid who developed a mild disease of cowpox, and they would not develop severe smallpox so as to develop this vaccine. As you can see here, a pair of brothers, one, you can see one who is vaccinated and the other not vaccinated, and caught smallpox, and the result is quite alarming, which result in the mortality in the adults, somewhere around 20 to 30%, and in infants up to 80%. And if one look at the estimate number of deaths in the 20th century alone, huge number, 300 to 500 million. And when the virus was brought to the Americas, basically the virus also killed 95% of the natives. But with successive vaccination, the WHO declared global eradication in December 1979. But when one look at the use of this exposure and then develop immunity, in fact, almost 300 years before Edward Jenner's work on cowpox, there was this Chinese doctor during the Ming Dynasty in 1549, when within his familial textbook of management of smallpox, and the family advocate blowing up scrapings of powdered smallpox scabs up into the nose, and the recipient would develop a mild disease resulting in immunity. But a small percentage of patients develop severe disease and potentially fatal. So, and this variolation method of prevention, in fact, spread from China throughout the Middle East and then to Europe. And it was quite widely practiced before Edward Jenner's cowpox vaccination. And if one look at the immune system, in terms of learning to recognize and respond to antigen, usually there is a primary response, and with a booster dose, there will be a secondary response, resulting in relatively long-lasting immunity. And of course, over the past year, we have seen a lot of different vaccinations coming to help to end the pandemic. And are they really the tools to end a pandemic? Well, let's look at the strategies being used, such as, for some of these infection, polio, measles, tuberculosis, there is using a live attenuated organism strategies. But of course, not all organisms can be attenuated, so there has to be some other methods, such as the use of inactivation. Right? For example, using a chemical formaldehyde to basically kill the virus, such as the Salk vaccine and some inactivated flu vaccination. There are also other methods, such as using subunits of the organism, such as the hepatitis B surface antigen, used as a vaccine to stimulate immune response. But of course, in order to make a lot of antigens or dead virus, you're going to need a lot of tissues, and many of these, they use egg as the tissue for growing, culturing the virus. So now, of course, we know about the how the coronavirus, how the SARS-CoV-2 attach to the ACE2 receptor of the respiratory membrane in particular, and get into the host cells. So there are methods of trying to develop the vaccine, and this is being used, would provide the instructions for the cells to make an antigen so that the immune system of humans can respond to such antigen. And this is being used in either the DNA or the messenger RNA vaccine, in which the small packages of by nanoparticles with a messenger RNA that gets into the host cells and express that antigen on the surface of the cell such that the immune system will respond to. So this has been tested with a DNA vaccine or mRNA vaccine, tested first in animals and then in human with a phase 2 trial. This is data from the Moderna's trial, another or one of the messenger RNA vaccine. And eventually, when one look at the vaccine efficacy, one need to look at the efficacy in terms of the number of infections. So if in a community where there are lots of ongoing infection, it would be easy to test out the vaccine efficacy. And also, the better the vaccine, the fewer the cases that will be needed to detect protective ability. But we can only look at the result at specific interval. For example, the current SARS-CoV-2 vaccines very often just look at the efficacy about 3 months duration, 2 weeks after the vaccination, and we do not know the long-term efficacy, whether we need a regular booster or a yearly vaccination. And also remember, viruses do mutate, as we can have seen. Many different variants have come in, causing major problems, such as the recent Delta variant. And there is a possibility that when these mutations occur, it could affect the vaccine efficacy. Here I'm showing you the data of the Moderna vaccine. As you can see here, the blue are the vaccinated group, while the darker gray is the placebo group. And in this trial published in New England Journal of Medicine, and approximately in each arm there is 15,000 subjects receiving either the vaccine or the placebo. And the efficacy is very similar to the Pfizer mRNA vaccine. As you can see here, the vaccine efficacy, we use the attack rate of the unvaccinated minus the attack rate of vaccinated divided by the attack rate of the unvaccinated. As you can see here, there were 90 cases of infection among the 15,000 subjects who were vaccinated with the placebo, while there were only 5 in the active group. So once calculate out, the vaccine efficacy is 94.4%. But one must remember, among the 15,000 subjects who got the placebo injection, there were only 90 cases of infection. So in other words, 99.4% of the patient did not get infected. So that's why if one work out the NNT number needed to treat is approximately 180, you need to vaccinate 180 people in order to save one person from getting infected. So with that, that's why when we assess vaccine safety, it's extremely important, because you're going to be giving this vaccine to a lot of people with very low risk of getting infected. And of course, in terms of testing safety, we need a large number, especially when we want to detect rare and serious side effects. And also, we need the time to tell us whether a vaccine has any major problem over time. And shortly after the widespread use of the Oxford AstraZeneca vaccine, which is an adenovirus vector-based vaccine, there were reports of CNS thrombotic event, and the majority of these patients were young women. And the estimate incidence in in the highest risk group were women between 30 to 39. You're talking about 1 in 100,000 cases of these severe thrombotic events. Subsequently, there were many reports, both the Oxford AstraZeneca vaccine as well as the Johnson & Johnson and the virus vector vaccine, and it was found that patients, the rare patients, were usually young patients, more female, would develop cerebral venous thrombosis and thrombocytopenia. It was related to the development of a specific antibody, which is platelet factor 4 antibody. So one must remember, in the usual regular vaccine development, it takes from preclinical to clinical, going through phase 1, 2, 3, it takes about 8 to 10 years. And the current vaccines that we're using against SARS-CoV-2, we have spent something like 9 months to a year to study them. Now, when people talk about efficacy, there are different numbers that are associated with different vaccine. The high being the messenger RNA vaccine, such as the Pfizer, Moderna, and then the subunit vaccine, the Novavax, and then the adenovirus vaccine. Now, very often people quote these numbers and they look different. But remember, these trials were conducted in different places with different background infection, and also different strains or variants circulating in the community. So sometimes it's very difficult to directly comparing these numbers. And also, one must remember that what exactly do we want from our COVID-19 vaccine? Do we want the vaccine to completely prevent infection, or we don't mind people getting infected if they're asymptomatic? Or do we want to prevent moderate symptoms, severe symptoms, or even death or ICU admission? And basically, if one look at the most severe manifestation, the severe symptom requiring hospitalization, ICU admission, and death, basically all the licensed COVID-19 vaccine can achieve 9% or more of protection against these severe outcomes. And that is most important. Well, you probably have noticed in one of the earlier slides that the majority of cases globally right now is in Europe and the Americas. Despite 2/3 of the world population is in Asia, actually the numbers have been relatively low, such as in places like China, Korea, Vietnam, Singapore, Japan. And the approach in these countries are slightly different because in these countries, they aim to contain and eliminate the virus from the community. So very early on, there was universal masking to cut down the spread from the infected individual. And also, the type of lockdown was extremely strict. I'm sure many of you have seen some of the footage from the lockdown in Wuhan in early 2020. And also, there are massive facilities built in different places, particularly in China and also in Hong Kong, with institution isolation, not home isolation. So no matter how mild the patient is, the patients were isolated from the rest of the community in order to contain the infection. And with this lockdown, there was a lot of criticism, particularly with the severe strict lockdown in Wuhan. And there was this report in the Washington Post saying this is unprecedented, and also the truth is those kinds of lockdowns are very rare and never effective. But that was in early 2020, and subsequently, starting from Wuhan to Milan to Barcelona, and then to Paris and London, and to the Americas like New York, Rio, and San Diego, basically all the country utilize some form of lockdown in order to control the spread of this infection. And in fact, there have been several scientific modeling estimation. In fact, it estimated that with the lockdown in China, there was massive reduction in the total number of cases and dramatic reduction in the potential number of deaths occurring in China. Well, so the Eastern approach has been to contain and eliminate the virus, in line with the experience of SARS in 2003. So with the mass lockdown, the tests and isolated, and institution isolation, not home isolation. Now, massive testing has been conducted repeatedly, particularly in China. For example, this example we summarize in the New England Journal of Medicine, a few cases of port worker and then hospital patients were infected in the Chest Hospital in Qingdao, China. And the city decided to kind of, lock down the city, would not allow the people to leave Qingdao until they are tested. And within a short few days, 4 to 5 days, almost 11 million people were tested. And people are not allowed to go on public transport unless they are test negative. And they are allowed to free movement within cities allowed, but they're not allowed to leave the city unless they are test negative. They also have to be isolated for 7 days and a repeated test in 7 days if they intend to travel. And until the second test is negative, they're not allowed to move around in the place of arrival. So massive testing, of course, this sort of massive testing required a lot of cooperation from the citizens. As you can see here, people would line up in different facilities, in stadium, and line up from the morning till late in the evening to have the test done. With that, despite being one of the originally infected person was a taxi driver, they managed to control the outbreak rather rapidly in Qingdao. So at the end, if you compare and contrast the mortality between different countries, I've listed out here as of this data as of correct till May 2021, the highest mortality, death per 100,000 population, as you can see here, we have, in places like in the UK is almost UK and USA is almost 200 per 100,000 population, and down to in Turkey is 48. And if you look at the Asian countries, we have Japan 8. Japan is considered very high in terms of mortality per population in Asia. So if you look at Singapore, it's 0.5 and China is 0.3. So just for comparison's sake, if you look at comparing France and Singapore, the mortality rate per 100,000 population is 290 times of that in Singapore. So you can see a difference. There are probably a variety of reasons that can explain this difference. Now, if one places a very heavy bet on vaccination, this is the prediction in terms of the how soon will the population be reaching herd immunity. As you can see here, yes, if you look at America or many Western European countries, yes, by the end of 2021, they may get a majority of the population may get vaccinated. But for the rest of the world, if you look at, some South American countries or African countries and the Middle East country and countries in Southeast Asia, with the exception of Hong Kong and Singapore, basically we have to wait until at least early 2023 before the populations are adequately covered. So one must remember, as long as there are lots of infection occurring in a few countries, there is possibility of new variants coming up, developed. And with modern air travel and mixing of people, these variants will reach the other countries rapidly. And if the vaccine are not effective against the new variant, basically one would not be able to stop the ongoing transmission. And if one look at the various emerging respiratory viruses over the last 20 odd years, all right, there have been many. They are primarily respiratory in nature. And I'm sure this SARS-CoV-2 is not the last virus we're going to see. There will be new viruses coming up, and we must learn from our experience how to handle these outbreak and pandemic. In conclusion, how do we put an end to this pandemic? Do we try to eliminate this virus on Earth or to mitigate? Well, there is actually a choice of how we want to end the pandemic. If you look at many Asian countries, the approach being used were very different from that in Europe or the America. Okay? And whatever way we do it, there will be a price tag. Okay? There will be a cost. Okay? A very strict lockdown economically would be very devastating. Okay? But only for a very short period of time if one are able to contain the virus. Okay? And also the number of lives saved from such regime would be very high. Okay? But of course we need public cooperation with many of these public health measures. I'm sure you have seen a lot of demonstrations around the world of or limiting personal freedom and whatnot. Right? So all these public health measures are effective if we stick to them. And massive testing capability is important. And following the mask, and when I see the news of arguing the use of masks, I just wonder why the fuss about putting on a mask. It's so simple. And various behavior as well as giving up the personal freedom all contribute to the control of the pandemic. And right now, both drugs and vaccine are playing a relatively small role, until the majority of population are vaccinated. And so I hope we all can learn from what had happened in the last year and a half so that we will be able to do better when the next virus or organism comes around causing a pandemic. And thank you very much for your attention.